And folks, we're going to jump in, if everybody's okay, to item A4 in the papers, and that's employability. And that's over to Joe.
Sorry, Provis, I just want,
no, good.
It's maybe me, but I'm not sure. I think you all concluded with questions and points in A3, but I don't know that we actually got their decision in A3 just before the adjournment. Sorry.
No, absolutely fair, David.
I don't want to open up again, but I think A3 does need a decision before we go into A4, sorry.
So, folks, we're okay with A3 after that discussion?
Yes.
Online as well? Yeah, we're okay, yes. Right. Thank you. Thanks, David. You're absolutely right. So we're on to A4 now. And Joe's going to introduce this paper on employability. Thanks, Joe.
Thank you, Provost. Members, this review and paper begins on page 184. I was the project sponsor for the review with Colin Hastings as lead officer, supported by colleagues within Finance and ICT and from the Programme Management Office within Corporate Support. The project brief was agreed by CMT last November and work began thereafter. The first task of the group was to carry out a full scoping exercise of employability services across the council, with heads of service asked to provide details of any employment support that they provide. The group did not define what was meant by employability so as to gather the widest possible information from each service. And while that scoping work was being progressed, the review group began analysing employability costs and the different type of grant income associated with employability. And this was used as the baseline and also as a way of confirming the information that was about to be received from services on the employment support that they provide. The team then also undertook a desktop exercise looking at the governance structures, reporting requirements, and minutes of both the local employability partnership and the No One Left Behind meetings to fully understand the types of employability services and processes through which they are delivered. The desktop review also allowed the group to understand the different delivery models and commissioning arrangements that exist within the council. Once this information was compiled, the group met with relevant colleagues across the council and thereafter arrived at an initial set of high-level observations and findings. And the group, at this point, having met with colleagues, saw the passion, the care, and the dedication that colleagues demonstrate across all of the employability services that are provided in the council. As a group, we established that the 5 stages of the Strategic Skills Employability Pipeline was a useful tool in providing a consistent approach to our work and in examining the various employability models that are in use within the services. As a result of this work, the group considered that the employability services delivered within economic growth, education, people and culture, housing and communities, and health and social care fell within the scope of our review. In terms of employability funding, this is shown at paragraph 28. Notice that as a council, we spent around £7.7 million in supporting employability services last year. Most of this provided via grants from Ayrshire Prosperity Fund or No One Left Behind, with each of these grants having their own bespoke reporting arrangements and monitoring arrangements and different sets, one from UK Government and one from Scottish Government. As a team, we also quantified the staffing resource that's in place in the 5 services that deliver employability services and the mix of staffing, permanent and temporary staffing that's in place. It's important to note that when services are delivered across the 5 stages of that pipeline, the staffing supports tend to be more intensive at stages 1 and 2, where we support engagement, assessment, action plan and personal needs and barrier removal, rather than at stage 5, which is in-work and aftercare support, for example. Indeed, the range of supports provided at stage 1 and 2 can be complex and include a whole number of other practical, nurturing and emotional supports to prepare that individual for their own employability journey. The report contains a summary of the different types of employability supports that are provided by each service against the 5-stage pipeline model, together with the total funding, the budgeted expenditure, and the staffing involved in delivering the service. It shows the different stages of the 5-stage pipeline that exists across the 5 services within the council and which overlap across some of the services. It also shows the externally commissioned services that our employability partners provide. As a council, members, it's heartening to see that the supports that this council provides are the widest possible, supporting individuals at the start of their journey, to extending this further by including various bespoke support for those individuals with learning disabilities or alcohol and drug dependencies, readying them for their own employment support and their own skills development into the job market. The review also examined the spend and the reporting arrangements and found that these are heavily influenced by the different funding types and the conditions of grant that accompany each fund, and for No One Left Behind and for UK Shared Prosperity Fund in particular. Moreover, and while these funds are especially welcome, they can act as a driver for siloed working and foster a fragmented approach to service delivery, not because of officer intent, but simply because of the grant restrictions and those specific conditions of grant that mean, for example, the opportunities to merge funds, consolidate, compound budgets, or consolidate approaches can be difficult. Indeed, we found that within health and social care, they use their own revenue budget to support a large amount of their employability programmes, and currently do not have access to the elements of grant funding that other council services have. The review group recognised the need for strategic oversight of all employability services to remove these barriers and maximise opportunities for spend and for enhancing and supporting individuals further. Moreover, some of the current employability processes we found retained practices that were part of previous funding programmes, which have been replaced, for example, with UK Shared Prosperity, which has a more flexible process, has no obligation to match fund, and a more streamlined reporting process, and has elements that support a wider interpretation of eligible spend. The report also highlights the sporadic nature of employability grant funding and how it tends to be time limited and has the danger of creating cliff edges when funding ends but programmes remain live, or alternatively, where we have individuals requiring support but funding streams have not yet been confirmed. The report asks members to approve the use of financial support or a guarantee-like arrangement that can be used where we find that funding is coming, but we don't have it in hand yet, but we know that there are individuals waiting for programmes. We also found that the conditions of grant also set out the expected deliverables from programmes, and that these are predominantly set at a much higher macroeconomic level. And given the importance that employability has within this council, as evidenced by the £6 million that you set aside for jobs and training, then establishing a more local set of performance indicators, together with a consolidated and consistent approach to maintaining and reporting performance via an integrated IT system, would be helpful in setting and monitoring expected outcomes for East Ayrshire and for those in our communities who seek employability support. The report notes the reporting through the LEP and the Employability Project Board, and the annual retrospective report to Cabinet on employability programmes. And having examined these, the review group suggests that elected members' involvement should be increased with specific in-year reports on employability programmes and, importantly, the outcomes delivered being reported biannually via the East Ayrshire Performance Report. This will support scrutiny and provide opportunities for members to challenge, to discuss and to seek approval. The recommendations promised are at paragraph 2 on page 184, and I'm happy to stop there at the high level and take any questions.
Thanks very much, Joe. Folks, we'll open it out again for any questions, any comments. I'm looking online, there's nothing there.
Ian Linton.
Councillor Linton.
Thanks, Provost, and thanks, Joe, for the overview of the paper. I think you're absolutely right to flag up in 40 that the staffing costs at 41% of the total budget do seem a bit high, and I think you're right to look at that. And I particularly welcome the agreement to advance fund when we know there's money coming down the line, but it's not in place to allow training to take place when it's needed. I think that's a really good idea.
Thanks for that. Folks, any more for the employability? Are we okay with the recommendations that Joe's outlined? Agreed. Thank you very much. A5 now, which is all to do with well-being. And Craig's going to introduce this one.
Thanks, Provost. Good afternoon, members. So this is the final of the 5 cross-cutting reviews. The review itself explored the scope to consolidate better aligned wellbeing services across the council, in line with the council and good planning partnership strategic priorities. Scope of the review was focused very much on adult wellbeing services, including mental, physical health, delivered or commissioned by the council, and aims to identify areas of duplication, streamline processes, reducing costs, and ensure we can still provide good support for staff and also for, and especially for residents of the council. In terms of methodology, there's quite a lot of detail in there in terms of how the review was undertaken. A range of research methods applied during that initial scope and data collation stages, high-level literature review that's reflected throughout the paper, and a desktop analysis of a range of relevant documentation, both at a local and a national level, to look at the key strategic policy drivers and just to frame and put the context of this work into the right space. A range of structured interviews were undertaken across the Health and Social Care Partnership with environment communities and with people in culture. There was also a range of focused discussions with CVO East Ayrshire in their role as the TSI, the Third Sector Interface, and the feedback from the Third Sector Showcase event that was held on the 9th of February of this year. That was particularly focused around about community health and wellbeing, and that feedback's also been reflected in terms of the context. Again, as others have done, I just want to offer my thanks to the core team in terms of undertaking the review. Thanks to Jim Murdoch and to Rosie within the PMO. That core team is supported by an extended team with membership there drawn from a range of service providers and key stakeholders, including wellbeing and recovery within the partnership, suicide prevention colleagues, alcohol and drugs partnership, people in culture, CVO East Ayrshire, vibrant communities. In terms of strategic context, there are a range of strategic drivers noted at paragraph 18 onwards that clearly have an influence around about this that have been considered as part of the review. For example, around about the Christie Commission, the National Performance Framework, the Community Planning Partnership and the Council strategic planning processes. A real focus in there, as you'd imagine, around about health inequalities. Wellbeing was, as you may recall, identified as one of the 3 cross-cutting priority areas for renewal and recovery as we come out of COVID-19. Again, a lot of that is still relevant even today. Caring for Ayrshire, the Ayrshire Growth Deal, the Council Strategic Plan and the IGIV Strategic Plan, again, all focus very much on wellbeing and have a real focus on that within those respective plans. The Alcohol and Drugs Partnership has its own strategic improvement plan, and again, wellbeing is a significant focus within there as well. In terms of the policy context, more at a national level, there are a whole range of policies and strategies in place, starting off with the Mental Health and Wellbeing Strategy published in June of last year, sets out the Scottish Government and COSLA's shared vision of a Scotland free from stigma and inequality, and a whole range of other wellbeing matters considered within that. That strategy has alongside a workforce plan and a strategy delivery plan to see how that can be implemented across the country. And within that strategy, it defines what mental health is, what mental well-being is, and what mental illness is, because quite often those different terms get conflated and confused. So that's detailed at paragraph 34, which I think is quite helpful. In terms of what is well-being, as I said, there's multiple definitions of that across a whole range of different places. The review team who were looking at it quite like the World Health Organization, who describe well-being as a positive state experienced by individuals and societies. So the recommendation 1 within the report recommends that Council adopts the following statement from the WHO as a shared vision of well-being. And that says, achieving for our people and communities a positive state of mind and body through good quality of life and a sense of meaning and purpose. In September 2022, the Scottish Government published Creating Hope Together, a suicide prevention strategy for the period 2022 through to 32. And again, that was very much focused on suicide prevention, which is one of the big areas in terms of our own wellbeing approaches that we also want to focus on and look at. And there's a fair bit of attention given to that within this review. Across East Ayrshire, this has been the case for a number of years and it remains the case. It's one of the main tenets of integration, health and social care as well. And that's round about tackling health inequalities and discrimination. And those very much remain ongoing priorities for both the Council and our community planning partners. We have maintained our commitment to mainstreaming equality, diversity, human rights across all of our commission services as well. And we note that paragraph 43, some of the primary causes of health inequalities are very much rooted in wider social and income inequality. And while we have an important role in addressing these, this is one of the areas that we know we can't fix ourselves. We can't resolve that in isolation. An asset-based approach to health and wellbeing recognises people are experts in their own lives and of what will best support them to be healthy and well. So recommendation 2 then goes on to propose that further capacity building work is undertaken with communities to address health-related issues and create opportunities for local leadership around health and wellbeing. In terms of the local delivery arrangements, those are covered across the community workforce at paragraphs 46 onwards. I'll just pick out a few key points there as well. So the IJB has responsibility for delivery against the national outcomes for health and wellbeing, children and justice services, and reports annually on these. That, as you'll know, goes to the IJB, but it also finds its way on here to full council and to the NHS board as well. Stated vision of the IJB is to work together with all of our communities to improve and sustain wellbeing, care and promote equity. So clearly that is a significant area of focus for us. Mentioned already the Alcohol and Drugs Partnership and their own improvement plan, which sets out a range of partnership actions to support people with problem drug and alcohol use in their journey to recovery, very much based on person-centred approaches, outreach work, creative and innovative service delivery practices. An awful lot of work around about relationship building, family inclusivity, recovery network, bringing people together and maintaining that. It was interesting, last week we had a session with the Permanent Secretary, and again with a bit of a focus around about some of this work there, which was really well received and actually quite hard-hitting at times as well. Within the Health and Social Care Partnership, clearly we have lead responsibility for delivering the community plan and partnerships wellbeing delivery plan through myself, and we have a joint meeting of the strategic planning group, the wellbeing delivery plan group. They come together as a single group to ensure that's as joined up and as coordinated as it possibly can be, and that works really well. Get turned to vibrant communities, we commission a significant lot of work from the community health activity team within vibrant communities. Some detail on that in paragraph 58 of the report, where we work very closely with the chat team and communities to offer support to people of any age to make positive lifestyle choices and to help them be more active. That activity work is really important as people get older, round about frailty, round about falls prevention, round about social connectedness, reducing feelings of isolation and loneliness. And again, so that early intervention and prevention stuff is really important in avoiding people coming into the statutory services or indeed to the front door of the hospitals. The HARP programme, which stands for Healthy and Active Rehabilitation programme, was launched in 2015 and it remains a real focus for us in terms of some of that activity round about health conditions such as cardiac or pulmonary disease, cancer, stroke, diabetes, etc. Again, to make sure people can stay at home as long as possible. Moving on to people and culture, who clearly look after the wellbeing of our workforce within health and safety. That team that sits within people and culture has been delivering wellbeing activities for our own workforce, but increasingly across communities as well, particularly around about some of the Here to Listen suicide prevention work, the Suicide Support Directory, Healthy Working Lives, particularly for our own employees, e-learning wellbeing courses, wellbeing campaigns, bulletins, newsletters, etc. I'm sure elected members will see that the same way as our staff groups do in terms of that the regular updates that we all receive round about that. So as I say, HR does have that exclusive focus on workforce wellbeing. Again, that's delivered through occupational health services, referrals into physiotherapy, health surveillance, employee counselling, and again, a lot of that's very much about early intervention. The employee assistance programmes are available online, and that's something that employees can self-refer to, and it's available 24 hours a day, 7 days a week, all year round. And again, I think that's pretty well received by any employees that we've engaged with round about those particular arrangements. People and Culture also have 3 wellbeing partnership arrangements with external organisations round about, that's detailed paragraph 68. Those groups are Able Futures, Beautiful Inside and Out and Healthy Working Lives, and that drives a lot of the work and activity that takes place within there. Turning to the third sector, and we do lean very heavily on the third sector in relation to the wellbeing work we undertake. through the CVOs, the third sector interface, that supports the local network community voluntary organisations and ensures we can engage the sector at the strategic level, both across the council and community planning partnership and the activities that take place within there. There's a couple of examples given within the report. There's clearly many more of these, but just a couple to give a flavour of that type of work in relation to the Community Connector service that's delivered through CVO, but very much about partnership working between primary care, community supports and general practices across our council area. Centre Stage is another example we've picked on here as well in relation to the Public Theatre and Arts Centre that we know is just down the road from us. Another really strong example of a third sector organisation with a strong wellbeing focus. Centre Stage are currently developing a whole system test of change within their own community, looking based on a human learning systems approach, developing new wellbeing pathways for people, learning from some of the creative ways of working to secure the best possible outcomes. It's probably fair to say the review group absolutely acknowledges the added value that the third sector and community partners can bring in relation to expertise, flexibility and adaptability to the needs of our community. And recommendation 3 within the report is asking that Council agrees that a local model of collaborative commissioning is further developed with delivery partners from the third, community and independent sectors to ensure that those best possible outcomes can continue to be delivered. There is a bit of work I've mentioned within the report in relation to the Pan-Ayrshire suicide prevention work, paragraph 75 through to 78, recognising that the Pan-Ayrshire work round about training, awareness raising, capacity building has seen a whole range of activities. Some metrics at paragraph 75 for the calendar year 2023, over 60 training courses delivered across Ayrshire. 768 participants in there. Feedback from participants was really, really strong, 100% recommending this training to others and 98% feeling more confident in talking about suicide. These courses are free and they're open to all delivery partners as part of the NHS Ayrshire and Arran Pan-Ayrshire training calendar, and we're really keen to start to promote that more and make sure we can sort of tap into that resource that's there. The responsibilities that are sitting within the partnership now represent the council and a whole range of strategic and operational groups for suicide prevention at a national level and at a Pan-Ayrshire level, and of course at an East Ayrshire level as well, with every suspected death by suicide reviewed by a particular group, just to try and understand trends and opportunities to make that better. Funding currently allocated to the council through the Scottish Government Choose Life monies. Recommendation 4 within the report recommends that council reviews the allocation of the Choose Life monies and aligns this with the suicide prevention activities that are currently being led by the Health and Social Care Partnership on behalf of the whole of the council. A consistent theme that was picked up as the review was taken forward was the need to ensure that the full range of wellbeing services can be accessible to everybody, they're well promoted and everybody knows what's out there. There is a local director of wellbeing services. There are, however, challenges in keeping that information up to date and current. There are also multiple online platforms that provide a directory function, and we've identified a real need in there to ensure that the information on wellbeing services, supports and interventions can be better aligned and centralised to improve visibility and access. Alice is one of those directories that we use in there, operated on a national platform basis, accessible through our own website. And again, that's one of those areas we want to really develop and build on over the coming months and years. In terms of consultations, we've got a lot of consultation pulled together and pulling this report and this review to a conclusion. The initial stakeholder consultations carried out January, February of the year. That work through providers recognised scope to improve and further develop working relationships and information sharing, and that will just continue to develop as we go forward. We've already referred to the third sector showcase event that took place in February. Trade union representatives have been kept informed through the well-established arrangements that we have in there, including the partnership forum that operates within the Health and Social Care Partnership. And also within the HSCP, we've been developing a participation and engagement strategy, which has given us the real opportunity to go out and talk to people as part of that process, which is clearly fed into this review as well, which has been really helpful. Part of the compare aspect of the review, a desktop exercise was carried out to assess wellbeing provision across other Scottish local authority areas. Maybe not surprisingly, what that concluded was there is no standard model of service delivery that we can align to. What is probably evident, however, in every local authority area, the Health and Social Care Partnership have a key role, both at the strategic and the operational level, around wellbeing. Other delivery partners include the TSI, education, community learning and development, leisure and culture, HR and organisational development. And again, if you look across our own area, that very much aligns to what we see here in East Ayrshire as well. In terms of comparing the benchmarking work that we've undertaken, we've done a bit of work with our through the local government benchmarking framework, LGBF, look at our own family group and how well we compare to our other authority areas within that. There's a graph at paragraph 93 that shows how that's moved between 2014-17 through to 18 to 22. The one that sticks out for us is the Western Isles. I'm not trying to say their Gaelic name because I always get a bit lost in there, but the Western Isles are the ones that have consistently been good and they actually have improved over that time scheme as well. So don't have much on their website in terms of the desktop review, much information available to just tap into easily. So recommendation 5 is seeking that endorsement that a greater level of communication can be built between ourselves and the Western Isles as an exemplar authority, just to see what they're doing that's a wee bit different, and is there anything we can learn from there and put into practice at a local level. The other piece of work that we've seen taking place at a national level within some specific areas is the Shaping Places for Wellbeing programme, jointly funded funding partnership between the Improvement Service and Public Health Scotland, with a bit of funding support from the Health Foundation and the Scottish Government in COSLA. It's a 3-year programme across a range of different sort of neighbourhood areas. Locally to us was probably Ayr was the closest one, but a range of towns across Scotland. That is only recently reported. It reported just a month or so ago. And again, we want to learn from that. So the local project action plans, we want to tap in there just to understand exactly what that looks like and if there's anything in there that we can pick up on. So recommendation 6 specifically is seeking endorsement for the communication between ourselves and other participants in the Shaping Places for Wellbeing programme to see what we can learn there. One of the factors, and this is picked up a few times already this morning, we want to consider as we go forward, given that we are going to be commissioning or continue to commission a lot of work from the third sector, is how do we get a really good shared wellbeing reporting system so we can get that performance information from across the piece, record outcomes, track progress, report referral pathways, and make sure there's a really consistent piece of work getting taken forward there. I think that will necessitate development agreement of a shared performance monitoring framework, looking at local and national wellbeing strategies and activities. So basically everything we've spoken about just in the last 10 minutes or so, trying to pull that together into a performance framework. So that feeds through into recommendation 7 of the report, asking that the Council agrees a shared performance monitoring reporting framework in order to better evidence impact and outcomes, noting that the services will be aligned with work at a national level, making better use of data and intelligence to support learning for improvement. I think that's where we can start to make a real difference in there. In terms of how do we structure this going forward, we're undertaking an option appraisal exercise. Details of that are considered at paragraphs 100, 101 of the report. The outcome that was most favoured or came out is at the top in terms of the scoring from the review team is option 2, where wellbeing services would be centralised and coordinated through the Health and Social Care Partnership. The review group concluded that the single lead service for wellbeing would assist in streamlining and simplifying the local wellbeing landscape to promote ease of access to services and give Council that greater oversight between the internal and external support services all sitting within the same place. So again, recommendation 8 recommends that Council agrees that planning coordination of community services centralised through the Health and Social Care Partnership. Similarly, in terms of wellbeing for our staff, it's proposed that paragraph 104 in recommendation 9 that the Council agrees that all workforce wellbeing services, interventions and supports would be led by people and culture colleagues to ensure consistency of approach and ease of access for staff. That covers all the recommendations. So just the final part of the report is a number of conclusions. Again, won't pick up on all of them. I'll probably cover them in the presentation to date, but just a few points just to fully recognise that there is a whole range of significant work being taken forward across all parties in support of wellbeing. Really good, strong partnership activity and investment in recent years. The proposals within this report would be intended to build on that, making sure that we can maximise the resources that are currently deployed across there, securing the best possible outcomes. The work that's getting taken forward here in terms of wellbeing, the early intervention prevention work is very much focused on keeping people away from our statutory services. We know that in times that are getting tougher in terms of the financial challenges that we're facing, and the work in here is very much about trying to keep people away from the statutory services to allow us to focus on the areas of greatest need within those particular aspects of it. So in summary, as I say, the proposed recommendations hopefully would enable the Council to deliver a more joined up and streamlined approach to wellbeing, avoiding duplication in efforts and services provided internally and externally, provides a comprehensive foundation for monitoring the effectiveness of wellbeing activities through better use of data and intelligence, and proactively provides straightforward, easily navigated, accessible wellbeing services for our communities and also for our workforce. There is an action plan and an appendix to the report, as everybody else has mentioned already, and I'm happy to take any questions, Provost.
Thanks very much, Craig. Again, a very in-depth body of work. Folks, I'm going to open it out for discussion. Councillor Mackay.
Thanks very much, Provost, again. Craig, it is with reference to recommendation 7. So one of the events that we know that we have lived through were some proposals in relation to, amongst others, within health and social care, UCAN and the Morven Centre. And in some discussions with organisations, what was coming forward was that lack of a very clear and explicit performance and monitoring framework. Could I there are new services which will be tendered for in
Maureen.
September. Could I
Maureen.
ask?
Maureen, you froze there for a wee while.
Oh,
Could you
sorry
go
about
back?
that.
No, it's okay. Could you go back and say what you were going to propose, please?
It really is in terms of I'm looking for some reassurance for recommendation 7 that organisations who might be likely to tender for services would be subject to this very clear shared performance and monitoring reporting framework. And the examples that I gave, Provost, were a couple of organisations that we've recently seen, and that would be UCAN and Morven Centre. And some of the issues around their continuing funding had been about lack of reporting mechanisms. So I'm hoping that this is teed in to actually improve things going forward. So it's just for an assurance on that.
Yeah, through you, Provost, and thank you, Councillor Mackay. So yes, absolutely gives you that assurance. So not just about those ones you've mentioned, but across all of our commission services, we want to have that really good, strong, robust, excuse me, performance and sort of management information systems in place so we can better manage those contracts going forward. So yes, absolutely, give that assurance.
Thank you very much. Very helpful.
Thank you. Folks, any other ones? I've got one, Craig, if it's okay. And it's that discussion that we have. I've got 2 on my books, if you like. I know that other councillors have. And that's where, after a survey, where an OT goes out into somebody's house who live in their own house, on their own or with a partner, and they need adaptations. And some of the reports coming back are saying, for all the right reasons that they're saying, is that the bathroom's too small to put a wet room in. We can't put a stair lift in because of the way the stair's built. So where do you get that balance between saving money for that person going into real care into a home, or keeping that person within their house? Are we expanding the way we're looking at things in terms of going a foot or 2 feet into an existing bedroom? To expand the size of the bathroom so that a wet room could be put in, because there's savings there, and we all know the most savings are if somebody's living in their own house as long as they can.
So happy to pick up on that, Provost, but clearly that's the issue you mentioned. There's not part of this review in terms of the wellbeing services, but I suppose the bit that does tie in there is if people are staying at their home longer, then the wellbeing supports we can wrap round about them is a very much a part of that, and the broader supports we can provide. The specifics round about aids and adaptations are areas that we continue to look at in terms of availability of funding, because clearly the longer we can keep people at home, then it means that the more expensive services round about, whether that's a care home or some other alternatives, clearly it is typically cheaper to keep people at home, but that does need to be balanced against the alternative. Is there an alternative housing provision somewhere else that it could go to? to. And I know within our colleagues within housing that housing stock's extremely challenged. We also know that the aids and adaptations budget is also extremely challenged. So it's just very much a balancing act between all of those things, and it does remain under active consideration. I know there are a number of queries, we get them regularly, in terms of some of those very difficult and challenging asks and specific queries that people have round about it, and we'll respond to each of them on an individual basis. But again, just hopefully gives you that reassurance that every one of them will be considered very much on a person-centred basis. It can't just be a set of rules that we apply blindly here. I think we need to be really sensitive to the individual needs round about it. But the longer we keep people at home, then the greater the ask round about that will be. I think we just need to recognise the financial pressures, and all of this need to be balanced against the very challenging circumstances that we're in. But happy to, again, probably if there are any specifics about it, happy to pick up.
No, I'll talk to you later on about that. It's just about the well-being for individuals, because it's better staying in their house longer. But I'll talk to you about that. Leader.
No, just to back you up what you're saying, I think we've looked at this in the past. You know, we've had reviews of the service, and I think that's maybe just something for noting. I think you know, as resources become scarcer, and often we find that some of the housing suggestions offered that aren't you know, really realistic, and you know, just the important thing not to lose sight is to keep, as you say, keep folk in the houses as long as possible. But that's maybe one for the future we need to look at.
Thanks for that, folks. Councillor Maitland.
Thank you, Provost. Thanks for the report, Craig. Again, it's a preventative and anticipatory report. It's what all the reports are doing. It's gone back to volunteers and third sector, like mentioned earlier. How we know that we're losing volunteers in all our areas, and they burn out. Now, as part of these consultations, obviously we'll be going to the third sectors and the organisations. How can we get to the individual volunteers to find out what their pressures are or why they leave? If we could even have an exit interview for volunteers, because they're the ones I think that hold the key to keeping these things going. Thank you.
So that's certainly something we can pick up. And I know through Vibrant Communities there's been a fair bit of work done about volunteering as well. But I think what we've seen during COVID, without going over old ground again, seen during COVID, there's lots of people came forward and did volunteer for a whole range of different reasons. After COVID, people going back to work, family circumstances changing, etc. We did see a lot of people leaving and not volunteering anymore. So there has been quite a drop-off in terms of the number of volunteers in there. Understanding what we could do, so understanding why that's happening is important. I suppose having a plan in place to try and build it back up again is maybe the more important part. So that's certainly something we're keen that we do pick up through Vibrant Communities, through the other third sector, through the TSI, to get into the other third sector groups to understand what better we can do to support volunteering across the piece. I know if looking at even us as an employer, other big employers in the area typically offer their employees volunteering opportunities. So maybe a day or a couple of days a year where people can give up or come away from their work for a day to do some volunteering. But then matching that person who wants to do some volunteering to what is a really good opportunity. Again, through Vibrant Communities, that's a piece of work that's taken forward previously to try and get those matches done properly, so we can certainly pick up on it. It's something that is on our radar. It is really challenging because the number of people who want to volunteer just now is not as high as it's been previously. What we can do to increase it, I don't think, certainly it's one of those other ones that we can't do this in isolation, but we can certainly maybe have a bit of a focus round about it and have those conversations and try and enable and facilitate a different approach to how we take it forward.
Thanks for that, Craig. Folks, any further? Councillor Richardson.
Thanks, Provost. No, really quickly, Craig made a really good point there. My other employer, Viva, I think it's 72 hours, 3 days a year. They give every member of staff to go and do volunteering. But what I would say to Craig is that obviously when you sign on in the morning, you're about to start your day's work, you've got your header page and you've got all your links to staff pages and what have you. What a lot of third-party organisations, and I don't suppose there'd be any block to a council doing this. You can actually get in touch with Aviva, and East Ayrshire Council could list all their volunteering opportunities, so that, you know, there's a lot of people work for Aviva in Ayrshire. Sign on in the morning. I've still got my 3 days. I've still got my 3 days volunteering to use. Sign on in the morning. There's the staff header page. oh, East Ayrshire Council looking for volunteers. Oh, there's 6 things that East Ayrshire Council are looking for volunteers today. So you can, you could contact large corporations that offer volunteering and get East Ayrshire Council volunteering opportunities onto their staff pages, and that would be a way of generating volunteers.
Good idea with the skills that those folk have got could be used. That's a great idea. Folks, anything else? Online. Thanks very much, folks. We're okay with that part of the health and wellbeing side. If we're okay with what the content of the report is, I'm going to move on. We're nearly there. Thank you. I'm going to hand over to Eddie, and this is just, I suppose, summing up with the cross-cutting themes and the further action taken. Thanks, Eddie.
Thanks very much, Provost. Although these have been 5 separate cross-cutting reviews, very much we've done them together. So we've had regular meetings of the sponsors and the lead officers and the support teams in terms of doing that. And at paragraph 38 on page 43 of the cross-cutting of the cover report, you'll see some of the cross-cutting themes. So maybe not surprising, but complexities in funding and commissioning of services. So at times when we've talked about coordination, this is why, because there's been complexity of how the money's coming in. Inconsistencies in available data, a lot of focus on outputs, so people going through programmes and things rather than the outcomes for the people. Gaps, as mentioned before, in terms of evaluation and performance information. Over to page 44, service level agreements out of date, are unclear what's expected of people. Sometimes more clarity needed on governance and decision makings in some areas to make sure we stick within all our different regulations of procurement and financial regulations. Issues with our back office systems and using some, kind of outdated models of that we could look at. One of the big ones is linked to that funding uncertainty is uncertainty among staff due to limited funding in some areas, but also in relation to some reviews being undertaken, highlighting the importance of engagement with staff, trade unions, so we understand and we listen to what people have been saying to us. And recognition that implementation of some of the recommendations arising have the potential to require short-term resource in order to provide, the longer-term benefit that we should. So there are a number there that we've recognised that cuts across what we're doing there. Members, in addition to the cross-cutting reviews, there are of course 3 service-specific reviews being undertaken, and again we mentioned them, outlined from paragraph 40. In terms of waste, early years and additional support needs. So I would, also say that we need to take them into account as we go forward. I said earlier, we also provide a commentary in progress with the strategic plan that will be reflected, the update from the community plan, the medium-term financial strategy, our workforce strategy and digital strategy. They all tie together. In terms of early intervention and prevention fund, members were aware we intended to have that engagement session on the 30th of May, likely to inform coming to this or the council at the end of June, but we had to postpone that due to the general election. We'll make sure that is rearranged. In the meantime, we'll prepare as officers to give best advice, and it's a real opportunity here that members have given us to make a real change in our communities over the next number of years. So we'll continue with that work and rearrange our session and get that best possible advice, internal and external, to us. I'm pleased to say, members, in terms of the Innovation Fund, we're bringing forward 2 recommendations for financial support. We've had a number of others that have came for innovation, and although we haven't funded them through the Innovation Fund, we've looked at other ways of supporting them and helping them develop some of the bids for that. So in paragraph 99, you can see the 2 that we're recommending for support from the fund. And the first one has been spoke about a number of times, about how we use in terms of our roads, resin materials as an alternative to bitumen. So that's one of the recommendations coming forward. And the second one is some of that successful work that we can all be proud of when you see our children and young people in schools in terms of some of the waste and, some of the net zero work. So again, looking at how we invest in the two specific areas. Members, then looking forward, and we outlined some of this from page 56 onwards. In order to look forward, we look back first of all, when we've mentioned a few times, the Christie principles in terms of what we aspire to. We also mentioned the risk appetite. If we're going to do things differently, then we need to be willing to actually innovate and do things, that might take a bit of risk. But it's one of the things that will take risk. And in terms of if it works, it's great. And if it doesn't, we'll fail early and we'll stop doing what we're doing. So in terms of the Christie Commission and our own vision and values, at paragraph 107, we set out, a number of principles in relation to the future direction of the council. And as I said very early on, to us, we will likely be coming back in terms of meeting the needs of the medium-term financial strategy, having to take difficult decisions. So giving us principles to what we're working around that is important for us there. Members, the scale of change we're undertaking will inevitably require a revision of how we will lead the council. The arrangements that you agreed in 2021 have, on the whole, worked really well. And as we look to implementation of the cross-cutting reviews and any opportunities that may come for shared services on a wider basis, also through a programme of base value reviews, we'll consider if any changes are required to how we lead the councils. But at this time, there are a few specific issues that I would note. The first being just the confirmation that the change of title for the Director of Health and Social Care Partnership to include Deputy Chief Exec title. That's not a change, right back from my days in 2014. I've operated at a Deputy Chief Executive level, and it's just a recognition of that. The second is, given the context we're working in and the need to take on additional duties to review the role of the Chief Financial Officer within existing HR policies. Some of that role that we need to take forward around relationships with both governments, AGD governance around that, and managing the medium-term financial strategy in terms of a support and challenge, I would want to review that role, and I would want to be transparent about that. And the very final thing I would say is around the leadership and management of the health and safety section. That transferred about a year ago to people and culture, and I would simply propose to consolidate this on a permanent basis. Members, they set out my final comments in terms of page 34, recommendations 8 to 18 on the cover report. I would commend them to you. And overall, members, thank you for your consideration of the reports that were brought forward today.
Thanks, Eddie. Thanks, everyone that has contributed from the officer side. Members, are we okay? Leader?
It's just to thank Eddie and the team, Richard and Craig and Joe and Ian for all the hard work they put in today to get us to where we are today, and just to thank them. But just in terms of update, members, what's the kind of plan for that? Are you doing it in a formal sense, or would you rather just do it in, I know October's no longer away, but what's your thoughts, Eddie?
To be honest, members will be led by you. My gut feeling is that we should likely be putting in the diary a couple of member seminars that can be formal. As senior officers, we're always available to the groups to come and update you on that. So maybe it's a mixture of that, getting a couple of seminars that's in the diary that people can see, and also giving that commitment availability to the groups, and also keeping close to any spokespersons and shadow spokespersons around it as well.
I think seminars, rather, groups. It's up to every group to do it. But I think seminars would be helpful just to monitor us as it goes through.
Councillor Mackay.
Thank you very much, Provost. And again, I would want to echo leaders' thanks to officers. This is a considerable body of work. And it must have been a very difficult job to have distilled everything down to actually these papers to present. So thank you very much for all of the hard work that's gone on. and for actually putting those down. Page 57, Chief Exec asks for the following principles. I made reference, I think, in one of my opening comments to our principles will be about being open, honest and transparent about the challenges that we face. Could I also go further down that list and say, you do make reference to we will make the difficult decisions about what we will deliver and how we deliver our services. I think that the process of going through what has been presented here has given all of us, officers and members, an opportunity to reflect deeply on what we have learned about the process that we've followed and how we have actually constructed this information, which is now in the public domain. So could I ask that as part of that learning, that we really need to expand our commitment to communicate better with communities and staff about the choices and also any limiting factors that there might be around those. I think that's going to be something that's really important going forward, because we really do want the opportunity to not be merely putting information out into the public domain. I think we've already seen some of the impacts that that actually has, some of perhaps the needless concerns that are raised by some of that information, and we really need a real effort to do even better than we are currently doing, Chief Exec.
Thank you, Councillor Mackay. I think it's fair to reflect, and members who were present at the GICC, you know, our consultation group with the trade unions, will see the real need that the trade unions wanted for information early, and at the same time our members saying, well, wait a minute, you can't put information over there before you've actually spoken to us about it. And then we've got the staff group and we've got other stakeholders, including the public. And, you know, we've found it hard to balance all that and get it right. And I think, you know, it's certainly starting for the member seminars and keeping, you know, members updated so as you can no surprises. But at the same time, you know, being very clear with members that sometimes when we have spoken to staff groups or when we have not spoken to staff groups at that time, and therefore, you know, trusting that we can go forward in that type of way. So the communication of this is for certain, you know, going to be, you know, one of the things. And it's not just about this. It will be about the communication about how we're going to balance the books of this council is going to be one of the difficult things for us to do. So yes, we will give that absolute commitment to all members to look to balance our communication between, you know, the members, our trade unions, our workforce, and any other external stakeholders, including partners that we commission services from.
Oh, thanks very much, folks. If that's
May I
us.
just finish with again one of my comments at the member seminar around some of this work was about we will all be judged, each and every one of us, if as a result of the work that is undertaken here, people within East Ayrshire can actually experience and reflect that they feel that services are delivering better for them. And that's a hugely high bar, but it is one I'm sure that we will all be happy to aspire to. That's the point of these hours and hours of work that staff have put in, that the hours that members have put in making decisions on this. The people in East Ayrshire need to feel that as a result of this work, their experience of services is better.
Right, thanks everyone. Thank you. Well, all that's left to say is come on Scotland tomorrow night. And good luck to them. Hope it's better than the last game. So thanks everyone for your attendance today, and thanks for all the input and the discussion. I will look forward to all the seminars and all the work that's coming up before October. Thank you very much.
Thank you.
Ian, could you stop the